Hello, my name is Dr. Castley Burdzy. This is my teaching demo for the University of Pennsylvania Psychology Department for the adjunct position of experimental psychology. So the topic of the discussion of this demo today will be understanding validity. This is one of my favorite topics in experimental psych, so I'm really excited to get to it. Okay, so what is validity? Validity is the appropriateness of a conclusion or decision. So if a relationship between two variables is valid, that means it is reasonable, accurate, and justifiable. So in other words, are we testing, as researchers, are we testing what we think we are testing? So there are four big validities that I want to lay out today. They are listed here in a little chart for reference, and then I will unpack each of them further during this discussion. So the first one is construct validity, external validity, statistical validity, and internal validity. So construct validity is how well the variables in the study are measured or manipulated. So it's the extent to which the operational variables that you study are a good approximation of the conceptual variables. So this could include your testing measures or things like that. External validity. How well are the results of this study going to generalize to a greater population outside of whatever has been looked at within the study? So, for example, if you're doing work in a lab, is this going to translate outside of your lab? Statistical validity is the extent to which the data support the conclusion. So this could be making sure that your statistical analysis is correct. And then finally, internal validity, the more basic validity, one of my personal favorites in a relationship between two variables, A and B, the extent to which A, rather than some other random variable, C, some extraneous confound, is responsible for changes in B. So let's unpack these a little bit further. But before we do that, let's take a look at what a confound is. So a confound is something that gets in the way of validity. So this is an extraneous factor that influences both the independent variable, the dependent variable, thus misrepresenting the perceived relationship between them. So the problem with confounds is that it could lead to an incorrect conclusion about the relationship between two variables or causation. So a confound is something that gets in the way of you being able to very clearly lay out a relationship between two variables. And it comes in all different shapes and sizes. There's a lot of different types of confounds, and that's what makes validity so fun to talk about, because we really, as researchers and as people who practice psychology or psychiatry or our therapists, it's important to understand those confounds and how it impacts the data that we are looking at. So let's begin with construct validity. So that was the first one on that chart. Construct validity addresses whether a psychological test or assessment measures the construct. So an example would be if a researcher is designing a testing measure for empathy, you want to make sure that the instrument's construct validity would be the extent to which it accurately assesses for empathy rather than some other variable. Making sure that those questions that are on your screening tools are accurately representing and testing what they're supposed to be testing or screening for. So one of my favorite examples for construct validity is taking a look at IQ tests. So IQ tests are a great way to measure, or any kind of cognitive testing is a good way to measure people's limitations or their strengths cognitively. So analogies, I think if most college students have been through at least analogies on some level with the SAT, the ACT, different examples of that can come up, but there's usually some sort of analogy on some IQ tests, and this example here might have some issues because it says opera is to composer as ballet is to blank. So sometimes we see socioeconomic differences or cultural differences in our construct that might impact the validity of the test. So it's possible that an individual taking an IQ test might be fully aware of how to do an analogy and have a really strong vocabulary, but due to socioeconomic differences or cultural differences, like not being, that not having access to an opera is a Western art form, and it requires usually a higher socioeconomic status to do things, to go to a ballet or opera, This might not be something that is culturally appropriate for an IQ test, so that might be a confound that gets in the way of the construct validity. External validity. So external validity is the extent to which the results of a study generalize to some larger population and other situations. So the easiest way, the simplest way to think about this is lab setting versus real world behavior. So just because it's happening in the lab doesn't necessarily mean it translates outside of the lab. We could have all sorts of influences that affect behavior within a lab of a student or a participant in research. So an example that I would like to give now would be, so if maybe you want to look at helping behavior and you're doing research on helping behavior and you're studying it and you're very quiet, UPenn lab, you might see really high levels of helping behavior given, the circumstances. But this might not generalize well to the chaotic streets of Philadelphia. So if a student steps out of that lab, is that helping behavior going to generalize? Is there going to be good external validity there? Perhaps there are other issues with it's noisy, it's chaotic. They might not be able to hear if someone is in need or be able to process additional stimuli to provide care or help appropriately. So that would be an example of external validity and being mindful of how external validity is impacted in the lab versus real world settings. Statistical validity, the extent to which the data support the conclusions. So statistical significance is a big one here. We want to make sure that you want to make sure that your data is statistically significant, looking at p-values and such. You also want to make sure that you are using your statistical tests appropriately. That would be a potential confound if you are not using the correct test. If you're running a t-test, you should be running an ANOVA or something to that effect. Internal validity. So can we confidently or accurately conclude a relationship between the independent and dependent variable in the study? So we want to make sure when you have good internal validity that the results are due to the manipulation of variables rather than the confounding variables or random chance. So if you have like a hypothetical example here, if a student, so if you're looking at young children ages 3 to 4, and you want to use perform an intervention of the 6-month mindfulness program and see if that improves their attention. Perhaps mindfulness, learning to focus their energy is going to, over the course of 6 months, is going to increase their attention span. But you didn't use a control group. So you're comparing, you're looking and seeing, wow, these kids had great attention. After 6 months, they did so much better. And look, I did my mindfulness group. Well, the issue there is that you're not comparing it to students or young children who have not had that mindfulness group. So it's possible that one confound here would be that attention improves naturally for children over time. That's called maturation effects. So improvements might be due to the development, their natural development, their brain development, not the program that you're implementing. So this is a good reminder that it's important for researchers to set up their tests correctly at the beginning of the study, accounting for confounds prior to beginning the study, making sure that their research methods are correct and going to minimize any confounds and have strong internal or any type of validity that's relevant to the type of study that you're doing. Oh, let me just move this up. Okay. Examples of threats to internal validity. So there are several examples here. I believe I just mentioned maturation, where there's natural changes over time. There's also history. External events during the study can impact the study's validity. Selection biases. Sometimes people choosing to be a part of the study gives a selection bias between groups. Instrumentation, changes in how the variables are measured can influence validity. Testing effects. So this is practice effects. If you're giving an IQ test and then you give it again, students will naturally become better at the test, and it might not be due to your intervention. Regression to the means, where extreme scores move toward the average. Attrition. This is a tough one. So I think at the beginning I mentioned attrition it's tough because there's not really much you can do about it except try to deal with it on the back end. We do our best with attrition. So at the beginning, I mentioned that we want to set up our study correctly. We want to make sure that we're minimizing confounds and threats to validity. But sometimes you can do a great job with your study, but there's attrition factors and people will drop out of the study and no longer want to participate. So these dropout rates might differ among groups, and that might impact your validity issues as well. So demand characteristics, participants guessing what's happening in the study and sort of changing their behavior based on that. That's why it's really good at the end of if you're working with human participants to ask them or interview them and say, did you notice this? And you debrief them, you tell them this is what we studied and what did you notice? What did you pick up on? Were you aware of it, to get a good idea of what kind of demand characteristics surfaced during your study? Experimenter bias, researchers unintentionally influencing outcomes. Sometimes the way we behave as researchers impacts people's behavior and how they're being studied. Sometimes even in animal subjects, that can be, sometimes animals can be quite perceptive in noticing certain things. So that's important to keep an eye out for. This is why we do double-blind research. And finally, placebo effects. This is obviously a very commonly known threat to internal validity, where just thinking that you got some sort of treatment changes your behavior, changes your outlook, and impacts your outcomes. So that is another reason to do a double-blind study. This way, subjects are not aware of what they are receiving, thus avoiding any issues with placebo effects. Oh, no. Oh, there we go. Sorry about that. Locked up for a second. Okay, why is understanding validity important? So this is why validity is one of my favorite things to discuss, especially in an undergrad class, although I love discussing at the graduate level too. Why is understanding validity important? Well, there's a few reasons. The ones I would like to highlight here are application to research. Obviously, as researchers, we want to make sure that we are minimizing confounds and having strong validity in our research. This gives a better outcome. This provides better information for people reading research. It pushes research forward. It allows people who are doing clinical work or applying that research to have a good standing of how to best provide care and utilize evidence-based practices. So by accounting for and avoiding confounds, we can improve the validity of our work as researchers. Now, application to clinical practice. So as validity improves, we have better data to help patients, help clients, help people who are or understanding cognitive issues or any level of understanding in psychology. When we are able to apply these things as teachers or therapists or in any area, we can do so with confidence because the validity is good. So as we understand validity, and we can also parse out what's helpful and what is beneficial for our clients. So it provides a higher level of patient care and better outcomes. And finally, application to the day-to-day. It might not be that obvious, but I think that understanding validity really helps us in our day-to-day lives. I think that we are inundated with a lot of information from authority figures, political figures, social media, where facts might not be 100% correct or false or misleading. A lot of times advertisements, for example, saying this herb is going to cure belly fat, whatever, any kind of thing like that. Are these valid statements? How can we, in understanding validity and what research, what it constitutes strong and valid research, how can we use our understanding of that to make informed decisions for our own lives? Which leads me to a discussion question, which is something I would normally pose to the class. Obviously, this is just a demo, so I'll just, talk about potential things that we could discuss. But how does our understanding of the 4 major validities counter misinformation? So in this global age of a lot of misinformation, and people are saying things and they're trying to get likes and they're trying to get clicks, how do we parse that out and make good informed decisions for ourselves, and use validity, our understanding of what validity looks like, to counter all of that misinformation? So hopefully that would be a lively discussion for the students. And I'd be happy to prompt or interject as needed, but that would be an example of a discussion question I would typically provide. And I believe that is my roughly 15 minutes. So hopefully that gives you a good picture of what my typical lecture style looks like. And I hope to hear from you. Thank you very much. I'm going to stop the share here and stop the recording. Thank you.